Hi guys, this is Dr. Hardik Ganatra. I'm a specialist plastic surgeon based in Dubai. I'm your host and your guide to health, fitness, and beauty. Today, on our first podcast, we have a special guest, Abdullah Lawadi. He's a very good friend of mine and a great human being.
Thank you.
So, Abdullah, please introduce yourself.
Thank you. Hi guys, hi the audience of Dr. Hardik. Dr. Hardik will tell you after how we met, but in general, it's the hardest thing to speak about myself. I don't know why, but I'm a fitness enthusiast. I studied in Arizona State University in the U.S. It was electrical engineer, definitely not my passion. Bodybuilding was my passion. It was like an extra curriculum where I dug deep into bodybuilding in terms of academic wise and the practical wise. Since I was in the US, it was like 4 years of just building muscle and just doing everything that has to do with bodybuilding. I came back to Dubai. I had to translate everything that I love and do into business because I knew that in Dubai, you would definitely need more income than just one. Yeah, life
And
is getting
bodybuilding,
hard,
I think, is not is a rich man's sport. I think you have to.
Exactly. It takes a lot from your pocket and gives you a little back. So I was like, I have to hit my peak, and if I'm gonna hit my peak, I have to translate my passion into business. So this is what I did. I run a couple of small LLC businesses, which are, alhamdulillah, slowly they're growing up. I have a gym called the Dungeon Power Building Gym. Power building is like a new concept of bodybuilding and powerlifting.
Yeah.
It's like strength and conditioning. And then I own Grab and Go, which is an electronic store that whatever I use of products in the bodybuilding industry, like cream of rice coming out, those let's say how can I say it? It's F&B of bodybuilding, like food and beverage that has to do with bodybuilding, low calorie foods, stuff that are easily digestible and stuff like that. So I have like a couple of franchised companies in the region in the Middle East, which is like Pride Foods, Flavor Gang, My Cookie Dealer. I have Professor Nuts, which is the lowest calorie peanut butter, a couple of stuff, and then the logistic company, which is Grab and Go. We give it like deliver to all the UAE and the whole Middle East. And I also own a cloud kitchen called If It Fits Your Macros, because I've been doing bodybuilding all through this concept of eating within my macros.
How many years has it been since you've been bodybuilding?
Yeah, let's say it's now 7th maybe.
7 years.
I'm still 27. Bodybuilding makes you look old.
Makes you look old.
Yeah, that's why I came to Hardik, so Hardik can make me look young now.
No, but that's also quite very characteristic of Arab genetics. All the Arab males I meet, the younger ones, like in their early 20s, even they look older.
It's the facial, hair, and especially when I'm bulking too in off season, I look like 40, which is good. It gives me privilege. When I go somewhere, like people really respect me.
They don't treat you so young. I'm like 10 years older than you. And
mashallah, and you look 10 years younger, mashallah.
Thank you, sir.
Okay.
Yeah,
so that's basically me. I'm a kind of person who just loves bodybuilding, and I'm not good at business, but I do have good partners in each and every company. So they run the operation side, and I'm just the face of it.
So coming to our association, I know Abdullah since 2019?
Yeah, just before COVID.
So I remember 2019, Abdullah came to me when I was working with Kakuna Clinic. He'd come over with a small little lump in both sides of the chest, right?
Yeah.
And I think that bothered you during competitions, right?
Yeah. It was just after Portugal Pro qualifier.
Oh, yeah.
And it didn't show that much. And you told me there's nothing. I'm like, just get rid of it. I'm like, okay.
Yeah, but it's very funny because that was my early exposure. If I have to be humble on camera, that was my early exposure into bodybuilders' gynecomastia.
Mashallah.
Because so far we used to treat a lot of puberty-related gynecomastias, which means guys, when they are about 13, 14, 15, there are hormonal fluctuations.
Yeah.
Estrogen is a little more than testosterone. And because of that, they develop some amount of gland, which they feel it looks like man boobs, especially in like white t-shirt or shirt.
Yeah.
And we used to do that very, very often back in India and even in UAE. But then you were one of the first few clients who came to me with a bodybuilder's gynecomastia. It was like lean and ripped, probably about 3, 4, 5% body fat, and just that small little gland. And I think that was the beginning of our interaction.
That's a funny story. In that day, I did 2 surgeries, or let's say whatever it is, that's mini surgery. It was this, and then you gave me, the anesthesia and everything, local anesthesia. And then after I'm done with you, and you put this, vest.
Yeah.
I went to a clinic to remove my...
the tooth.
Yes.
Oh wow, okay.
That day was it was a bad day for me.
Oh, more for the tooth, I
More
believe.
for the tooth, yeah. Especially when the anesthesia starts fading away and you start feeling the pain, and you don't know the pain is from here or here. You know, it was bad. It was
Yeah, but
bad.
funny
Yeah.
enough, most of the bodybuilders never complain of pain in the
No, 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 no,
chest.
no, 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 no,
So,
no. It's very rare.
but I've
It's very
had my
rare.
teeth removed, the third
Yeah.
molar, so I know how that feels, and that's
It's
not
very bad.
that's
Yeah,
not
it's
that's
very
not
bad. Never
nice.
do two operations in one day. That's a bad
Yeah,
bad
and I
move.
did not know about it. Otherwise, I would have definitely not advised him to do that.
Yeah, yeah, yeah. I
Yeah,
like to finish stuff
but
very fast.
Abdullah, about gynecomastia.
Yeah.
So I really wanted to know because a lot of our audience would like to know, especially there are a lot of bodybuilders who follow me as well, and they would like to know as to why gynecomastia happens for bodybuilders. Like I said, for puberty, I completely, I educate them a lot on how there are hormonal fluctuations.
Yeah.
For bodybuilders, gynecomastia also, I think hormonal fluctuations remains the same
Kinda, yeah.
reason. But what is it more about? Like, how can you describe it in details?
Yeah, I would just add one more case, which are the obese guys, because aromatization, which is the conversion
Testosterone
to estrogen, it actually doesn't happen just from, let's say, hitting puberty or hormonal fluctuation. Also, aromatization can happen from adipose tissue. So more adipose tissue can convert to estrogen, and that can cause also. That's why we get people in the off season where more, let's say, reasonably more fat there is. You can get those side effects more. So when it comes to bodybuilding, I don't want to dig deep into the academic side of it, but just in general, there is testosterone, there is anabolic steroids, and then we have the androgens, which are let's say the oil-based testosterone, oil-based hormones. And then the androgens goes into three families. We have the testosterone and all of the brothers, and then you have the DHT and all the derivatives, and then you have the 19 nors and all the derivatives. Usually, the aromatization happens within the first family, which is testosterone, equipoise, Dynabil, Boldenone, which some people disagree of using. It has no cases on human being. When this aromatization happens, some people are hypersensitive, some people are not hypersensitive. So it's a unique characteristic in the human being itself. It's a genetic game. Like genetics in bodybuilding is everything, literally. Even when it comes to gynecomastia. Like I know people with crazy doses of testosterone, like
And
1,000,
having no gland at all.
zero side effect. The funny thing is that when you even check his blood work and you see estrogen to androgen ratio, his estrogen is crazy high.
And
But there's
still no
no
gland.
side effect. For us, we don't really care about how high estrogen is because we are friends with estrogen. You know, estrogen is good for libido, for mental clarity, for joint health, for a lot of stuff.
And
Estrogen,
this is extremely important because a lot of people have an idea that for males it's just testosterone, estrogen is
exactly.
for females. Why do we care about
and
it?
they want to block it with using a lot of AIs, which is aromatizer inhibitors.
Inhibitors.
Yeah, like Arimidex, Norvadex, these SERMs. And then when they do that, they don't put into consideration that these stuff can affect their health indicators, which are the cholesterol and lipids go crazy high. And so the nice side about the drugs of bodybuilding is like it's like a puzzle. You need to know what to do at what time, and you need to know the literature behind it. Plus, when you do it on the real life, some people just respond differently. That's
Still, yeah,
that's why I love bodybuilding. Like it's very hard to know, but it's good to know the literature because you have a base to rely on. So some people are sensitive with it, and then they develop this gland, and then on stage, because bodybuilding, as you said before the podcast, like behind the scenes, you said that it's a cosmetic game, or what do you call it? The beauty.
It's like a beauty
contest.
for males.
Yeah, so whatever you do of lifting heavy weights, sleeping well, eating your nutrition, doesn't really matter on stage. The judge is gonna judge you on how you look. Exactly. So when you're there and you look perfect, and we are perfectionists, we really want to look good. We want to see feathering in the glutes, We want to see everything perfect, like conditioned to the bone. And then you see that swole in your
Little flaw.
in your nipples, and then some judges actually degrade you on that. Like they will drop your points because you do have that, and they would call it like something that can ruin your physique. I don't know what they call it in English, but something that can hinder your physique and may drop your points. So that's why bodybuilders usually go to the surgical part
Yeah,
of
I
it.
think there are a lot of bodybuilders. I think William Bonac did a
Yeah,
surgery. Terence Ruffin has done it.
Yeah.
Countless people, but I think
Yeah.
James Hollingston.
Most of the Olympians,
of
I would say, they did the gynecomastia surgery. Like, if you go back to their history, eventually, at one point in their career, they've had this and it showed on stage. And then you see the next time on stage, there's nothing. And the funny thing is that's why I always refer everyone to Hardik, because Dr. Hardik, when people tell me, are you sure he is good? I'm like, listen, this guy is a bodybuilder. He knows what you want, you know. So when you go to him, this guy, he loves bodybuilding to the point that he knows what you want, and then you go there, he'll do it. Because some people I've seen, doctor, ruin your nipples. Like your nipples are like damaged.
But I think it's also about your knowledge of aesthetics, like how you said you dug so deep into bodybuilding that now every little thing about bodybuilding, be it supplementation, nutrition, sleep, managing stress levels, everything you're so aware of. Same way, like for us, like we are student for aesthetics, you know, for beauty, both for males and females. Right now, of course, we'll be talking about male aesthetics more so.
Definitely.
But yeah, this is chest aesthetics. I mean, a lot of people don't know about it. When they are doing a chest lift, for example, I get a lot of guys who come with massive weight loss. So, you know, people who've lost about 40, 50, 60 kilos. Recently, I had a guy who had lost about 100 kilos of weight. So when they lose so much of weight, they present with loose skin everywhere. There's loose skin in the chest. The nipples are down here and they want it lifted up. The butts are falling down, sagging. Despite of how much ever muscle mass they build, the skin is not going to be lifted up. So that's when our role comes in and we lift it up. A lot of people don't know where the nipple position should be. A lot of surgeons don't have an idea about that.
Okay.
So the knowledge of aesthetics is so important that if you actually, you know, F up in that,
you get ruined the whole thing,
Yeah, and that too for a bodybuilder. That guy makes money out of it.
100%,
You are actually ruining a livelihood of a person.
That's a lot of responsibility.
Yeah, that is a lot of responsibility. I also recently have been getting patients with lumps, you know, when they inject steroids, either in their deltoids or in their buttocks. I think. So, what do you think is the reason behind that?
It's a multifactorial, to be honest. There's a lot of reasons behind this scar tissues that guys get from pinching the same area every time. One of the reasons I've seen guys using loads of oils at one shot, let's say they do 3-4 mLs at one shot, instead of microdosing into different muscles, because androgen can be taken sub-Q and can be taken IM. Intramuscular, yeah. So some of them, they are, let's say, have phobia from doing shoulders or, like, let's say, lats. So they just stick to one area. And then years after years after years of injecting same spot frequently every week, or let's say 3 times a week. And then the scar tissue start building, especially if they don't do it well, or especially if they don't take the hygienically procedure well. And then they create a lump. And the lump, when they start pinching again, you feel like it's going through a hard surface, you know, like that's how bad it is. And then sometimes on stage, as we go back on stage, because we do all this because we want to stay on stage, goes on stage, flexes his glutes, and then glutes is flexed, and then there's a lump here, and it shows, you know, and everyone can see. And now we are in social media, so people even zoom in like crazy and see everything and will expose you. So then this lump happened to me once, and I came to you. You can explain that case.
Yeah, so basically, Abdul had come over about, I think about 6 months back when you had
maybe
lump
even
in the
more,
upper glutes.
a year ago probably.
About a year ago, and he had lumps in the upper part of the glutes. Because of testosterone injections. And I used cortisone. So basically, there's something called triamcinolone. Triamcinolone is a cortisone which we inject in this fibrous tissue. This cortisone breaks or degrades the fibrous tissue, and which is then absorbed by your lymphatic system and is peed out. It's thrown out in urine. So what it does is it degrades this collagen, which is the scar tissue. So scar tissue basically, for the audience, because people cannot visualize what scar tissue is. I do operate so many bodies, and I get patients who've had liposuctions done before, and they come with hard lumps
Okay.
It can also happen after liposuctions.
Okay.
The reason being after liposuction, if there is extra skin, that extra skin will accumulate a lot of fluid. You know, like a sponge that when you clean utensils, if you clean your plates and you have the sponge, that sponge absorbs water or waram as we call it
Waram,
in Arabic.
yeah.
So a lot of the tissues after liposuction absorb fluid. Now, if there is extra skin and the skin has not been treated with the tummy tuck, some surgeon would probably just do a liposuction and not remove that extra skin.
Okay.
Then that extra skin will accumulate a lot of water, and the body will convert it into scar tissue. In Arabic, I think we call it talayuf.
Talayuf, yes.
Talayuf.
Yes.
So that scar tissue again can be disintegrated with cortisone. But the biggest problem with cortisone is cortisone can destroy anything that it comes in touch with. So if cortisone is superficially injected under the skin, it can actually thin down your skin. It can even cause hypopigmentation. It can actually lighten the color of the skin where the injection is done. And if it's injected deeper into your muscle, it can actually destroy your muscle.
That's the whole point, yeah. Because when you told me about the local cortisone, I was like, doctor, are you sure I'm not going to lose muscle in that area? You told me about it. You told me about this explanation that you just said. Because we in bodybuilding, we are enemies of cortisol. We love anabolism, but we don't like catabolism. You know?
Catabolism,
yeah.
yes.
We don't want any breakdown of muscle. So we want to do hypertrophy as much as possible, no atrophy. So that was the thing they're scared of.
Which is why cortisone needs to be injected right in the scar tissue. And the funniest part is, the scar tissue is so hard and strong that it does not accommodate that fluid, that cortisone. So what I do is I poke my needle into the scar tissue repeatedly in different angles to make tunnels, to make channels inside that scar tissue. And those channels will accumulate some fluid, which will then work. And then a month later, 3 to 4 weeks later, I would call you back, which is what I think I didn't need to do that for you, surprisingly, which is amazing. You had a very tiny lump anyway.
Yeah, very small.
But I think recently I had another guy who would come through your reference.
Yeah.
And
it was in his glutes too, yeah.
It was in his glutes too. And he needed 2 sessions, and I might go in for a 3rd session as well. So if they've got bigger lumps and harder lumps, then you can't do it. Rather, in trying to be over enthusiastic, if you inject too much of cortisone in one go, it will not go in the scar tissue and it will diffuse elsewhere, which is it can diffuse under the skin. Your skin can atrophy.
Okay.
So it can cause catabolism, like, for the skin.
Yeah.
And it can actually form like a jarah, like an open wound there in the glutes.
Okay.
And if it goes deeper, it can ruin the muscle.
Some patients, which I've seen have talayuf, which is the thing you just mentioned, go to an emergency and then they inject them with Voltaren. What do you think about this?
Voltaren for scar tissue?
Yeah, I feel like this is
I am not quite aware. Because Voltaren, funny enough, Voltaren also, I've known of people who've had Voltaren and formed scar tissue.
Okay.
Because if it's not done hygienically, in a lot of, I've had a patient from Africa who had injections, painkiller injections in the buttocks, where she had fat transfer. Do you know about fat transfer to the butts? A lot of female clients of mine get a procedure which is called Brazilian butt lift. In that procedure, we remove fat from the areas that they want to. Let's say it's the arms, it's the throat, it's the tummy and back. I remove that fat. We harvest it, we purify it, and then we inject in the butts to make the butts look bigger. If they have like a hafra or a depression in the butts, then we inject it. This procedure is called Brazilian butt lift. One of my patients from Africa, she had this Brazilian butt lift, very happy with the results. I've posted it a few times. And that lady happened to have some infection in the body, not related to her butts. This is a few years later. And she had a Voltaren injection in her bums, but this probably was not done hygienically, so it actually caused infection and fibrosis in her bums.
Okay.
And to the point that I had actually had to make a small cut and take out the pus, and I have to scoop out some fibrotic tissue as well.
You're just making me more scared of this.
No, which is why I think we did have a conversation about it as to how to avoid scar tissue lumps, because this would be very valuable if you could repeat that again. How do younger people, because a lot of people in fitness industry are not aware of these drugs. As much as these drugs seem very enticing, to build a lot of muscle mass, there is a dark side to it.
100%.
It's a calculated risk that everyone is taking.
Yeah. Nowadays, because it's becoming more more mentionable in the social media. People talk more about it. The awareness is more. So they're kind of normalizing it, but they're still not. They're kind of showing you that it's a safe way of using anabolics, and there's no safe way of using it. There's a safer way.
Safe, exactly.
Yeah,
It is safer.
yeah,
not
but there is no
safe for
safe
sure.
way for sure. Because and let's go back to how humans are very uniquely built different. If let's say I give you a case of people injecting loads of mLs of androgens into one spot each and every time, some people
Don't have this scar tissue
don't
lump.
have the scar tissue because you're just uniquely built different. But we're just talking in general. Like, if you ever got this, you have to go back to how you've been using it. Probably you've been using the same area every time. Let's go back to the category you're competing in bodybuilding. Some people do men's physique and don't really care about their bums. So he's like, okay, I'm covering my half of
Even
my
if
body.
they have the scar tissue lump, and by the way, this is for the audience that the scar tissue lump does not pose a risk to you. It's not dangerous.
Yeah.
It's a scar tissue. Scar tissue is made of collagen. You know, collagen is what the whole world is running behind, especially most of my female clients, because everyone wants to look young, and collagen is what makes your face, your skin looks tighter. So scar tissue lump is full of collagen. It's dead tissue there, which doesn't have a lot of blood supply. So a scar tissue lump does not pose you to any danger. The reason why bodybuilders come to us is because it does not look good on stage,
Yeah.
but it doesn't actually bother them in their personal lives.
Yeah, exactly. And also because of the bodybuilders, most of their stuff are taken not through, let's say, a pharmaceutical company. They're taken underground or taken from a black market. Usually the oils are not purified oils, or let's say they're not been done well underground lab.
It's
And
like adulteration. It's like mixing stuff.
exactly. So that can also cause the infection in the spot that he's injection.
Hygiene could be one of the
Hygiene
reasons.
could be
and a
one of
lot
the reasons.
people-
Using the
I'm-
same needle every time.
Same needle every time. And I'm like, a needle costs, actually, we're just talking about me and my manager,
Nothing.
talking about the cost of needle. It's 21 fills.
Yeah, nothing.
It's
yeah.
nothing. But the cost of it, when these
Yeah.
guys come to us for cortisone injections to a plastic surgeon, and then he has to do it multiple times, that's way more expensive than a 21 fill needle.
Exactly. So preventing the thing to happen is better than actually solving the
actually
issue.
curing,
Yeah. It's good to know, and it's good to know that we're uniquely built different. So that whatever guideline we mention, whatever case we say, does not have to apply on each and every individual. You have to just keep it at the back of your head. So let's say something happened. Okay, this is what happens. This is how can I solve it? Yeah, but as I said earlier, like, you always should keep that knowledge. That's why they say this topic came up about bodybuilding. Is bodybuilding all about experience, or is it all about knowledge? I would say it's a mix of both, because whatever action you'll take, it's based on a study or a case or a knowledge that happened, and then by time, experience just comes by. So yeah, you should always have something to rely on, like,
But
in case something happened. Yeah.
it's good to have basic scientific knowledge before you
Exactly,
start
yeah.
in, because I see a lot of patients. Actually, again, interestingly, I get a lot of young males and females who are training, but they did not know how to train. So they've injured their knees while squatting or something. And then they actually stop training for years together, and then they come to us with a lot of fat accumulation, and I have to do liposuctions for them.
Yeah.
And after that, I still tell them, I can give you a push by removing this fat for you, but that's not the solution. The solution is to go back to the gym, train, because training is not just about looking good. What do you think about that? Is training just about looking good? Do you just train so that you look good and you can compete, or what? Because I have my own take on it, but I'd like to know from you.
It really comes down to, because if I say training to look good, I can show you tons of bodybuilders who looked ripped and good for magazines, and once you do their bloods, it's really bad. So health isn't determined by how good you look. It's by how good you really are through blood works and other stuff. But in general, when someone does any sport, I would say the only way to sustain the thing is enjoying it. So if you are going to do something because you want to look good, then that's a temporary motivation. It's going to end soon. Because when you look good, then you're done. Then what's next? You don't know. So as long as you enjoy doing something, you'll keep doing it no matter what. For me, bodybuilding is not building muscle. For me, bodybuilding is enjoying lifting weights. Just give me this dopamine in my head, and then I feel I've accomplished something in my day, and this just keeps me going. So as long as I have this checklist that I have to do it it's like eating breakfast, like Arnold said, eating breakfast. If I don't train that day, I feel I'm missing something. And then all other things in life just
they don't fall in place
don't
because
fall in
you
place.
missed the most essential, probably,
Exactly.
one of the
exactly,
most
yeah.
essential steps.
Exactly. So for me, it's like to achieve sustainability, you have to achieve enjoyment, and enjoyment comes through what you like doing. If you like doing kickboxing, just keep doing. Be active. Just be active.
That's most
Yeah,
important,
just
right?
be
So
active,
like
yeah.
Phil Heath in one of his, I think, one of his seminars, he mentioned that bodybuilding is a purpose-driven lifestyle.
Yeah.
So you have a purpose. You're going to the gym for your health, for your fitness, and for your aesthetics, to build
Exactly,
muscle.
yeah.
But it's a lifestyle. So he always says it's a marathon, not a sprint.
100%. It is a marathon. Yeah. Yeah. For me, like I've built muscle. It's like a byproduct. It just happened to be there, But it was
and I'm
never the
sure-
intention from the start.
I'm sure right now you wouldn't be measuring. So this is again very interesting for young, I would say newbie bodybuilders coming from someone as experienced as Abdullah. Do you take measurements of your biceps? Because I see a lot of younger guys who I meet in the gym, and of course I'm nowhere close to Abdullah. I mean, look at his size and look at me. But I get these young guys who look at me and say, bro, what's the size of your biceps? And I'm like, I don't remember the last time I measured. I did it like probably 15 years back because I've been training for 23 years now. Yeah. In the gym, off and on, based on my education, because I finished 4 degrees whilst I was going to the gym, so it's been long. But I started bodybuilding looking at Bollywood, are you aware of Salman Khan?
Of course, yeah.
So he comes out, topless in a song, and everyone goes crazy about it. And that was my first motivation of bodybuilding, because you're like, if I have these kind of muscles, I'm going to get a lot of chicks.
Yeah.
And that's the biggest myth, I believe, that chicks don't dig muscles. What do you think about it?
Of course, yeah. You get more muscles, you get more men. That's the bad side of it.
That's the bad side. Actually, that's the dark side of bodybuilding more than anything.
It's not steroids. Yeah, that's one of the myths. Yeah. But we all start like.
We all start with a fickle motivation, and then...
But to me, that should be the natural way of thinking, because females want to become more feminine. Men want to be more masculine.
And that's how men were to begin with. If you go to Greece, I think if you've traveled to Europe and you see statues in Rome and in Greece of Greek gods, and they're all with six packs and everything. They're not those males with...
the issue's not in us, the issue's in the ladies. They're choosing the wrong guys now. They're not choosing guys with muscles, choosing guys with money.
So that's the story of my life. By the way, Abdullah just got married. So
yeah, alhamdulillah. Alhamdulillah.
What's your wife's take on muscles?
She doesn't like it.
Oh God. Okay.
Yeah, she's also into sport, mashallah.
Oh, mashallah.
She's more of endurance-based sports, like
which is amazing.
Running, horse riding, but she's like competitive sport. Yeah,
wow,
so we share the competitive side. I think
you've dialed down in terms of competitive side. You're more into like business and coaching people now, and your wife is more into competitive.
Into more competition, exactly. Yeah. And I also do coach a lot of endurance athletes.
Oh, is it?
Who are enhanced, of course, because let's be real, like, and the enhanced side of sport never started in bodybuilding. Why do people point the fingers on bodybuilders and say that they are not natural? Because they look not natural. But let's look at Lance Armstrong. He's 7-time champion of Tour de France. He's skinny. But there are enhancers there are also PEDs in the end, There are enhancers that he's used, and he also admitted that.
I know of golfers who've been using testosterone.
I know
golfers.
Because nootropics and stuff like this, they use a lot to help them in like thinking more, focusing more.
So that's something that I want to touch on as well. So there's something called PEDs, which Abdullah mentioned, but I don't know if everyone has information or knowledge on that. PEDs are performance enhancing drugs. There's a whole lot of classification on that. I made a review paper in COVID because I had nothing better to do, and I'm a bit of a nerd. So I made a full big paper on PEDs. It's like a review paper, gathering like 10 different journals and their articles, and then made a summary on it. But Abdullah is a living summary, so I think he would better elaborate it. So can you please elaborate for the audience as to what performance enhancing drugs are? What's the classification? One of them is, of course, androgenic
Yeah.
anabolic steroids, which is
Yeah.
AAS.
Yeah.
Then the other is nootropics. Can you touch more on what nootropic is? What is
Yeah.
creatine? This is for general audience who doesn't really know much about
Yeah, so
these.
PEDs is anything that would give you a super physiological reaction in the body and makes you superhuman, let's say. So a
It's
human
like
being,
the Captain America serum, yeah?
exactly, yeah. So a human being can achieve a certain, let's say, roof of performance, and then you just want to push it to the unnatural side. Then that when PEDs comes in, and then it's always this saying of use the right tool for the right job. So for bodybuilders, we're looking for saturating more androgen receptors by using more androgen drugs. And then you look at an endurance athlete, they want to increase as much red blood cell as possible to drive more oxygen into the hemoglobin. So they use stuff that increases RBCs, like, EPOs, they stuff
So
like...
EPO is erythropoietin, and
Yeah.
erythropoietin basically stimulates your bone marrow to produce more red blood cells.
Exactly.
More red blood cells means you have more oxygenation ability, which means they don't get so fatigued when they are into either endurance or ultra endurance sports.
Yeah, and then there are stimulants, which some players that MMA fighters use a lot, that can enhance the...
I know of one which is caffeine.
Caffeine,
Which
caffeine.
everyone knows about.
Caffeine is a
which
drug,
is
yeah.
coffee, which is actually a drug. But of course, when people take coffee, they don't consider it as a drug. What besides
Actually, no,
caffeine?
you know that some federations of like jiu-jitsu, they consider caffeine, they will test you for caffeine.
Wow, okay,
Yeah,
that's
so,
interesting.
yeah, they would consider it as, I think they do have a limit, so they would consider that also a drug. Like the high doses of caffeine can also disqualify you from certain sports. Yeah, so stimulants like ephedrine, HCl, stuff like
So ephedrine
euhembine.
is again an important stimulant.
Yeah.
Ephedrine is also used for something called ADHD,
Yeah.
which is attention deficit hyperactive disorder,
Yes.
because they need more stimulants because
Yes.
they have a deficit of attention.
Yeah.
What else? Sorry.
Yeah, and then you have a clenbuterol, which is for asthma. And then you do have, I don't know if euhembine is considered a drug, but then you have ephedrine, synephrine. Those are the stimulants, let's say,
So
which I'm aware of. Probably there are more, like Russia, mashallah, they're doing compounds every single day and trying to sneak into sports without getting catched by the WADA and different other federations that are for anti-doping. But yeah, so we, as we said, we have the androgens, we have the stimulants, and then we have the peptides, which are the growth hormone, the insulin, the IGF-1 insulin-like growth factor, which is the TB500, BBC157, and all these stuff. So it's a big world. I'm still like a small, tiny guy who's still trying to learn, But yeah, we're slowly trying to, and then you find the applications which are like crazy in real
Very
life.
diverse.
Yeah, and then you find people who just say, okay, I'm a bodybuilder that I'm gonna use tons of, let's say, stimulants. I'm like, but why do you need that much? You want to build muscle, like you don't want that much stimulant to build muscle.
So why do bodybuilders use stimulants?
Some of them do have the characteristic of binding with beta cells or fat cells, and then increasing fat
oxidation.
Oxidation, yeah, exactly.
So can we equate it with stimulating or spiking your metabolism?
Exactly, you're just yeah, exactly. So it will just spike your metabolism, your resting metabolic rate, and then
Or the BMR?
exactly, and then you will require. Let's say a higher deficit. So then maybe you're eating more food because your metabolic rate is higher, and then you're building muscle, losing fat. So but then you have to know that each and every drug you're using from the PEDs has a side effect, and this side effect can hinder the whole process. Let's say
It can be counterproductive.
exactly, like people push hard on, let's say, clenbuterol, and one of the side effects is insomnia. If you don't sleep, that's a mother of recovery. Now you're destroying one of the main pillars of building muscle, which is not sleeping.
And then you expect yourself to be building muscle, which is again
Exactly,
so
yeah.
counterproductive.
So-
I know women. I know a female friend of mine who was into powerlifting, and she tried clenbuterol, and she said she used one dose, and she said, I cannot take this drug.
Yeah.
I have multiple nights of insomnia, jitteriness, shakiness and shivering and all of that. So I know of a lot of people who have jitteriness and tremors because of C4.
Yeah, it's from caffeine, imagine. Yeah. That's why we're
And
telling.
C4 is 200 milligrams.
200,
It's like,
that's nothing.
this is 200 is nothing.
Yeah.
I mean, I use C4. I'm probably tolerant to C4 now after like 15 years of C4 use.
Yeah.
But
The high dose of caffeine, I've studied Mano Hanselman PT course, which I consider one of the best courses available. He mentioned an equation of caffeine. It's 6 times your weight in kilogram. So let's say your weight is 100 kg. 600 milligrams is like your highest dose of caffeine you can take.
Okay.
Yeah, and it really comes down to adaptation. Some people just get adapted
So
to
there's
it.
something called tolerance when we talk about drugs.
Yeah.
Like if someone's taking a lot of antibiotic courses back to back to back, they develop something called antibiotic resistance, which means now if you've been taking same augmentin tablet for the past, let's say about 4 or 5 years, now if you take it for some infection, you would not have any effect of antibiotic.
Okay.
For that particular antibiotic, because the bacteria have got used to that antibiotic. This is called antibiotic resistance. This is coming from doctor. This is the nerd in me which is kicking. Similarly, when someone is consuming a lot of caffeine over years and years, someone like myself, which is pure 200 milligrams of caffeine, there is something called tolerance to caffeine, which means the body is now tolerating caffeine very well. So it does not give you any side effects. So I barely have any tremors, and I inject people in their eyes, in their lips and everywhere without any tremors, and I can do it very effectively, and I'm still on C4.
Yeah, that's what makes it more complicated. That's why we tell people, like, try your best to get out of this world, because when you're in, just things that just get, especially if you're a type of guy that's very hypersensitive, then things just get complicated so much, and then you barely see results, and then you go into depression and stuff. So you stay away. That's why I'm saying, if you want to hop into PEDs, just make sure it's worth it. Like, would you make something out of it? Is there an income? Would you be a superstar? Would you be a celebrity, a model? Or is there something back? Like, convince me to use it.
So I talk about something called risk-benefit ratio.
Yeah.
So that's the reason why we encourage bodybuilders. I mean, people, you guys should definitely follow Abdullah, because you do a lot of podcasts.
I do Arabic content. I don't know if you have Arabic followers.
Yeah, but I think you should start with English content also
Inshallah,
for people like us, because that would be very useful, by the way. It's just because I think what you're doing is amazing, which is educating people on drugs, on bodybuilding, on exercise, on biomechanics, on so many, touching down on so many topics, because a lot of people do not have the patience or time or the interest to be reading big books. Like I was reading Brad Schoenfield. Do you know Brad?
Yeah, of course. Brad is one of the
Brad
best
Schoenfield
guys in
is
biomechanics.
He's the guru of hypertrophy before Mike Israel and other people came in. And I have a book by Brad Schoenfield. I've studied that.
Yeah.
But how many people would want to? My education favors me to do this. There's
And
no big deal about it. But for a normal person to understand that book of, CPK and all those, the pathways, MP and all of that is just so difficult.
Yeah. And the funny thing is that Brad Schoenfield tweeted once and said, biomechanics is a very mysterious aspect of bodybuilding. Like, imagine all of these books he've written, and then after that he tells you it's a mysterious aspect. This is how bodybuilding is complicated. Like, each and every person is unique. Genetics come into play. It's a multifactorial. You can never point out one thing and say it's like talayuf. We talked about scar tissue.
Some people
You can't
have it,
say it's because of this.
Because of this. You can't point a finger at a particular cause.
Yeah, it's like it just
And that
builds
makes
up together.
it very
Yeah.
fascinating as well, which is the reason I'm so keen, although my primary profession is plastic surgery, but that's the reason I'm so keenly interested in bodybuilding.
Yeah. This is where experience comes in. Yeah, it's like when you know literature, but then you do it on multiples of people, and then you see different reactions, and then you can't say like literature is BS, but you can say that okay, literature is there, but then people
Literature gave me the foundation to understand this, and then I consider the factor of variations.
Yes, 100%.
So, Abdullah, I get a lot of patients in my industry who come for a quick fix. Now, these are patients, these are people who accumulate a lot of fat in the torso, thighs, arms, wherever, and they come to me to get a liposuction done to slim themselves down. Again, there are reasons for everyone to do these procedures, and I'm no one to judge anyone as to why they are doing it or something. But I do educate them that these procedures should not be used as a quick fix. If I do liposuction for their tummy and back, and if their diet is not under control, if they're not exercising, they'll definitely be accumulating a lot of fat in other areas, because what I am doing is undoing the past, which is that accumulated fat in the tummy. I cannot prevent the future fat accumulation. So the question to you is, do you get people also who come to you for quick fixes like, hey Abdullah, I just started going to the gym now. Can you give me some injections or something, because I need to build up a lot of muscle mass?
Yeah, I usually use this saying in Arabic. We call it ما تقدر تصلح ما أفسده الدهر. You cannot repair what the years of past did damage, So I have to explain to him in a way that all those years accumulated of damage needs a lot of years to repair. So that's when it comes to that's why people go to the quick fixes and the cosmetic side, because it's easier, it's instant. Where bodybuilding, or let's say whatever method we use to drop weight, it takes time, and then people just want. We're in a rush world now. Everyone.
It's all instant gratification.
Yeah, so that's one of the setbacks that we have right now, but. It really comes down to the person, how he thinks in long term. If he does it right from the start, he can live forever healthy and looking good. But then some people actually need that start a new chapter, like you said, like liposuction, start a new chapter, and then that's it, like crazy motivation. Like, I don't want to go back looking like how I look.
How I used to.
Yeah,
I want to change. I want to use this as a jump start to a new life, and
exactly. Yeah. So I would say it's a good and a bad thing, maybe.
Yeah, I would say everyone deserves a second chance.
100%. Yeah.
So if someone's going through a bad time and they've accumulated a lot of fat, and they tell me, Doc, please help me out with this. I promise you, I'm going to use this as a motivation, and you're going to see a different me. I get a lot of motivated clients, and thankfully, I'm perennially or forever obliged to bodybuilding in my life. Because of that passion, I inculcate a lot of motivation in my patients. My consultations they're never less than 45 minutes to an hour. And out of an hour of consultation, 30 minutes just goes in me talking about health and fitness to them. And I'm not a fitness coach. I'm a plastic surgeon, technically by profession. But I want them to do these procedures for the right reason.
Yeah. I would also blame the coach. Some coaches in the industry, I would also blame, because they just make it. I wouldn't say they make it sound really hard, but the approach they use to lose fat is very rigid, and to the point where someone just gives up really, really fast. As I said before, sustainability is what we want. Sheikh Mohammed Barashid always says about sustainability. We had this year of sustainability year in Dubai. So how do we make sure that this guy? I wouldn't say there is no easy path. However, science gave us a better path than like we're using the road instead of using the sand. So what science told us about thermodynamic, low calories in, calories out, this will make the person himself design his protocol according to his lifestyle. This is sustainability. However, when I go to a client and tell him, listen, you have to eat this, and this, that's not sustainability, because this client has a life, and sometimes according to his situations in life, he cannot follow what I'm giving him. Let's say I gave him like a lettuce burger in the morning, and he has no accessibility to lettuce burger. What would he do? When you teach him about calories in, calories out, and this much how much your body needs, and in order to lose fat, you just have to eat in a deficit, this can make him more flexible. And then let's say we give him a 2,400 calorie intake per day, and let's say that's a 10% average deficit for a male. And then he says, okay, I can do weekdays of 2,000 calories, and then by the weekend, I know I'm going to enjoy with family and friends. I saved 400 calories of those 5 days, or whatever it is, and then you do 5 times 400, that's 2,000 calories. Oh, that's a good number. I can enjoy a big meal. I'm still in a deficit of the weekly intake.
So you don't need to be starving on a daily basis. You don't have to make your life miserable trying to lose that fat. There is, like Abdullah said, there's not an easy way out, but there is an easier way out.
Exactly, yeah.
So that's something which is called flexible dieting.
Flexible dieting, flexible dieting, which I think Lyle McDonald's is the one who spoke about. Yeah, I think it's Lyle McDonald's. Yeah, so he talked about having 80% of whole foods and then 20% of enjoying, let's say, junk. I wouldn't even call them junk, but
I would use the word comfort food, probably.
Yeah.
For some people, it's chocolates.
Yeah.
And you can't call chocolate as a form of diet. But it's just a comfort food. But that's rich in carbs and sugar, so that would definitely increase your calorie intake.
Yeah, exactly. And won't satiate you. That's why we always blame certain foods, but we don't know the reason behind it. Like we say donuts are bad because of sugar. No, donut has no sugar. Donuts have tons of calories and a very small portion, which can make you eat more often very easily. That's the issue. The issue is that we are overeating more than how much we're expending in terms of sports. So that's the issue. So when we explain that to nutrition is easy. It's 101. Like if you literally take 5 minutes of your life, listen to basic nutrition, you can build this skill forever. Like, it's easy. You just apply it to your life. It's super easy.
Do you have a video on nutrition as well, or are you coming up with one?
I reached a point where I don't even talk about nutrition because of how like it's like خلاص guys, you know, like you have to know it. It's calories in, calories out. If you're a lifestyle guy, don't look at macros. Just look at calories. Eat whole foods. Have a a margin of enjoyment. Just be within that. It's everything in the world has a capacity. Like I can't.
There's a range.
Exactly.
You don't have to stick to a particular number. You don't have to weigh your food every single day unless you are competing, which is a different.
Exactly.
Which is a different genre of fitness in itself.
Always right tool for the right job. You don't choose the approach of a bodybuilder to lose weight. No, that's another thing.
That's rather completely against sustainability because you can't do it for more than probably like a day or something.
Exactly. Even the top elite bodybuilders retire one day, you know. Like Dexter Jackson was like, I'm going to retire because I miss eating whenever I'm hungry. Now I have to eat 7 times a day. I can't, it's tiring
and
for 50 years old bodybuilder.
Yeah, even overeating is tiring. But this is what you talked about, what you touched, which is having a donut. So how would you compare a donut with whole food? Let's say a lot of rice or pasta.
Let's say a crispy, something people know. Krispy Kreme glazed donut has around 200 calories, 190 to 200 calories. On the other side, 200 grams of potatoes, which is this big and has starches and complex carbs, it's also 200 calories. Now, if I give you both plates, I give you one donut, which is just half of my hand. My hands are just abnormal. Anyways, and then I give you tons of potatoes. Which one will make you more satiated? Potatoes. It wouldn't taste as good as donuts,
but that will definitely fill up your
stomach. Your stomach is always, I tell people, stomach is like a balloon. You fill it up as much as you can with stuff that has less calories. So more volume, less calories. You feel full. You don't want to think about eating more or binging more. So, but this stuff I would call like it's an old thing. Like people should know about this already.
Yeah, I think this is basic. So I have a video on YouTube which is called Science of Healthy Eating.
Okay.
And I made this. It's a 1 hour Zoom video that I did again during COVID. And this was based on Mike Israetel's book, which is called RP Diet.
Yeah.
So it's a Renaissance periodization diet. And I studied that. And then I made a full my summary to teach, and I taught a lot of plastic surgeons, doctors, and general public about how to be more mindful when you eat.
Yeah, exactly.
So you have a plate of food, you go for a buffet and you see a lot of food. You should have the ability to distinguish the good food or the right food from the wrong.
Exactly.
And this comes from education, and this is basic education. This should not need, and this doesn't need any qualification or a degree.
Yeah, it's
and then
simple.
practice implementation.
Yeah, because people say, "Oh, this would get me into eating disorders," like which to be honest happens very rarely, especially with ladies. They get so deep into counting calories to the point where, if she eats, let's say 5 calories, she'll go run for like 10 seconds to burn this 5 calories. They reach to this point, like they're so linking everything to calories, and then their life gets miserable.
But I think that's kind of unhealthy obsession.
That's unhealthy obsession, yeah. But in general, people say the moment I tell them count your calories, they're like, man, I don't want to count. But come on, you count your salary, you count your days, you count your hours. Come on, count your calories. It's simple.
And Abdullah, I think a lot of it is eyeballing. So as you start counting your calories, you don't have to count your calories every single day of your life. You count. Yeah. I mean, at your stage, I don't think you even count calories.
No.
Because you'd look at food and you would know roughly how much. Exactly, you'd probably be missing it by 5 or 10%. You might say this is 234 calories, while it might be like 225.
Yeah.
But it's not going to be 500 and you call it as 230, right?
Exactly, yeah.
So you start to eyeball better, and that makes your life not even like you're not even miserable doing that because you look at food. So that's what I do now. I go for conferences, I travel, I look at food, and I'm like, this should be about 250, 300 calories. I think I can have this.
Yeah.
What about vegetarian? I'm a vegetarian, by the way. I'm a lacto-ovo-vegetarian, so I consume dairy, I consume eggs, and I consume veggies. I don't consume chicken, meat, fish, any of that. So, what do you think about that? Because I've got a lot of audience, and I've got some audience from India as well, but I've got a lot of audience who are slowly turning into vegans or vegetarians, and they feel like building muscle mass as vegetarian is extremely difficult.
Yeah.
So, what's your take on that? And on vegan protein as well. So, I'm sorry, I'm
Yeah, but
asking
yeah,
you a lot of questions.
vegetarians, when they, if is it from an ethical or religious side?
I just grew up this way. So, yes, I think it's a religious attribute. But to be fair, I believe in one religion at this point. So I believe in karma. I believe in one religion. I would happily go to a mosque and I would happily go to a church. But that's just me, and that's a personal thing. So, that's not related probably.
Yeah,
but how I grew up, they considered meat to be like a sin. It's a sin to be eating meat.
Okay, makes sense.
And so that's when we never had meat in our life. And I'm happy not eating meat. But
And you're fine with that now, yeah.
Yeah, absolutely. I've rather see, you don't miss what you've never had.
Yeah. It's like Jay Cutler when he said, "I've never tried KFC, so I'm not gonna crave it."
Yeah. So a lot of people keep telling me, "Doc, you don't know what you're missing," and I'm like, "Yes, I don't," and that's the reason I don't give a shit.
Yeah.
Because I don't know.
So don't try it, doctor.
But there's something which is a very good substitute, and I don't know, again, because I don't have chicken or meat, so I don't know how chicken or meat tastes, but I have vegan meat now.
Okay.
So there are companies like
modified food.
No, these are made from soya and yellow peas. The one, the Beyond Meat, the Beyond Burger.
And in Starbucks. Bro,
you get it everywhere. So you get Beyond Burger, Beyond Meat is a company, Thrive is another company.
Yeah.
There are a lot of companies which are coming up. They are plant-based
like
meat.
Yeah.
So if you've never tried, you actually should.
I tried. In Starbucks in the UK, they do have Beyond Meat sandwich. And it tastes even better than the sandwich, to be honest, And
I have Beyond Meat, one portion of Beyond Meat, every single day. It gives me about 24 or 25 grams of protein.
Yeah.
And then I have 2 shakes of whey.
Yeah.
I have 6 egg whites. Mm-hmm. And I have some avocado and about 200 grams of tofu. Mm-hmm. And soya milk.
No, you're covering your protein easy.
So, no, I constantly speak about protein because I always say, especially with Indians, and the reason I'm being like a little biased towards Indians or against Indians is because Indians are inherently deficient in proteins. We're not talking about bodybuilders. See, your field is completely different. Your size, the people of your genre of fitness are on a different plane. You can't build this much muscle without protein. So you're like a human, protein beast.
Yeah.
But the guys that I meet on a daily basis in the gym, as patients, as friends and relatives, they are all deficient in protein because they don't know how to get the protein from. And I say it's so easy.
It is easy, yeah. And especially that Mano Hanselman, from the last research, he pointed out for people who don't even train, to just maintain your lean body mass, you need 1.2 grams per kilogram. So if you're weighing 100 kg, you just need 120. That's what, 6, 7, 8 scoops of whey protein. That's nothing. That's not taking into consideration any trace protein from bread a bit, from oats a bit. Because when you count everything from trace, you end up with like 50 extra protein. And then if, let's say, you have 150 grams of chicken, that's another 50, you're done. You got your protein intake, easy peasy. Now the issue, one of the things that I also tell clients when it comes to fat loss, train, resistance training. Do resistance training because that builds muscle. Eat your protein, that builds muscle. The more muscle you build, the more your BMR is, your basal metabolic rate. That means what? You're going to eat more, lose more body fat, and look better. So there are some stuff that you can tell people to encourage them to do that will help them in their journey of fat loss. But then when it comes to vegetarians, actually I've never had a case, but from what I've learned, as you said, there are tons of plant-based protein. Now when it comes to bodybuilding, now that's another story. Because as bodybuilders, we're looking for a highly profile amino acid food.
Which is when we talk about bioavailability.
Yes.
So if you're consuming vegan protein, you probably have about 80% of bioavailability. So the vegan protein might say that 1 scoop will give you 25 grams of protein, but you're only getting about 80%, which is 20 grams of protein, not 25. So you're actually missing out on the 5 grams there.
Exactly. Yeah,
but if you consume whey on the other hand,
Yeah, it's like very high
It's
efficient.
100% bioavailability.
Yeah, that's because of the profile of amino acid it has. So yeah, when you go to meat, it's a more nutritious food. It has more amino acids, more essential amino acids. That's that's gonna give you a what 2, 3, 5% extra gains, which no one cares, but bodybuilders do. That's why I'm telling you, bodybuilding is another story. But if you're a lifestyle guy, just hit your protein from whatever it is, even trace protein from oats, bread, whatever. Count them up all. You hit your 1.2 times your weight in kilogram, you should be fine.
But for someone who is into resistance training, someone like myself,
Yeah.
I recommend to shoot anything between at least a minimum of 1.5
Yeah,
to build some amount of muscle mass.
Yes.
Because what you mentioned when you said 1.2 is to preserve the existing muscle
Yes.
mass you have. But you're not going to get bigger or jacked at 1.2, right?
Yes.
This is for lifestyle guys.
Yes, yeah.
But you should at least hit a minimum of 1.5.
Yes, yeah. 1.6 to 2.2, that's the range of
2.2
yeah.
is where the ceiling, as per Brad Schoenfield, I think you hit a ceiling at 2.2, but I don't think that's entirely true for bodybuilding.
No, that's the issue with bodybuilders, because bodybuilders, we have very rare studies, because
Because they are a different breed. Because they are,
Yeah.
I would say, bodybuilders are biochemically altered.
Yeah, exactly, yeah.
So you cannot compare what you did your studies to normal human beings with
100%.
Captain America's.
We can just we can just get like a insight of what's going on, but then when we apply it, we see different stuff. Because we are not just jacked, but we use enhancers.
So there are a lot of variables playing.
A lot of variables, and then those variables trigger how much we need of protein. But in the end, I've tried in real life with bodybuilders who take anabolics and they're huge as 300 pounds with 1.6 grams per kilogram. It's perfect. Some of them actually even have better digestion and less bloating in their digestive system, and also help them a lot. I used to be a big fan of 3.2 grams per kilogram. I'm slowly reducing it down, giving more margin for carbohydrates so I can push performance and training. Yeah.
So this is something that I want to touch on as well very quickly, which is called protein sparing effect of carbohydrates.
Yeah.
Which means when you go in surplus, because a lot of people, a lot of audience who want to get into bodybuilding don't know what calorie surplus is. Why do you build more muscle mass when you are in calorie surplus? Over to you. I mean, what's
No,
your...
you can say, mashallah, you've done the RP. I'd like to hear different perspectives. Wallah.
So from what I have learned, and you can correct me if I'm wrong,
Yeah,
I'd be
yeah.
happy to be proven wrong because that's learning for me. But what I've learned is that carbs have a protein sparing effect, which means if I'm on maintenance calories, I would probably need about 2.2 grams per kg body weight of protein to build a certain amount of muscle mass. This, if I was in calorie surplus, then I would, let's say, about 300, 500 calorie surplus per day, then I might actually drop that protein requirement from 2.2 to 2 grams per kg body weight. Am I correct?
100%. Yeah. It's one of the protocols that I've also used when it comes to bodybuilding. So yeah, that's completely right. But we don't want to confuse the audience. Like when it comes to the audience, I would just tell them follow thermodynamic law. Eat on a maintenance.
Calorie in, calorie out.
Yeah, done. Yeah, you want to gain more weight. If you're like super skinny, you want to gain more weight, just be in a surplus. I wouldn't say eat on a surplus. I would say be on a surplus. Because some people actually eat on a surplus, but because they are
would the
so
difference
active, because by the end of the day, you have to be in a surplus energy state. Because we have how much you consume equals how much you expend through sports. And when I say expend, it's not just through sports, it's also through non-exercising activity. So when I sit down and keep shivering my legs,
If you fidget, if you keep moving around, you get a call and you're moving around, you don't
Exactly.
consider that as an exercise. This is called non-exercise activity thermogenesis, which is neat.
which is neat, exactly, yeah, which also plays a bigger margin in burning calories than...
Which is one of the reasons why we advise our patients, especially I advise my patients to count their steps. The whole step
Yeah.
counting came because of this reason. Because
Yes.
technically, you can't call 10,000 steps as an exercise.
Yeah,
You
exactly,
could go on a
yeah.
walk and call it an exercise, but technically, you could even be walking to the washroom and back, and that's still technically burning calories, and you're not even aware about that.
Some people say, but brother, I eat so much food, which he is actually, and he's in a surplus, but I'm not gaining weight. Yeah, because you're doing so much.
So
that's
you're
why I say-
burning so much as well. So then
Yeah.
you need to either burn less
Or
or probably
eat
eat more.
even
Now,
more.
if you tell me that, brother, I cannot eat more than what I'm eating. I'm eating like a pig all day and I have a job to do. I can't be eating all the time.
Yeah.
Then expend a little less.
Less, yeah.
Wherein the choice of exercises or your activity becomes important, which was my next question to you.
Yeah.
If a lifestyle guy like myself, because I don't plan to compete, but let's say if a lifestyle guy like me comes to you and says, Abdullah, brother, tell me 5 exercises, or 10 exercises, you can pick a number.
Yeah.
Give me 10 exercises that I should do and I will build good muscle mass.
Yeah, compound movements, done.
So what are the compound movements that you would recommend? Because for a lot of audience, again, they might not be completely aware of compound versus isolation movements.
Yeah.
Compound movements are multi-joint exercises, while isolations involve a particular muscle only, which means you won't be using other muscles while you're doing isolation exercise. So,
Yeah, or some people call it accessories too. Yeah. So compound movements, I would go with the main 3, the 3 big lifts, which is deadlift, squats, and bench. Those 3 big movements for a lifestyle newbie guy who just joined the gym will make tons of gains. Yeah. So because basically a deadlift literally moves every single muscle in your body, either isometrically or like from like concentric and eccentric motion. So deadlift is one of those lifts that will trigger a lot of muscle and stimulate a lot of muscle at once. Bench press for upper body, it's even good for your lats because you also, you retract your scapula. That's you're putting your lats into an isometric position. That's even stimulating. When you're a newbie, you just joined the gym. Anything you do, it doesn't have to be a full range of motion. Even isometric holds and stuff would also trigger into muscle growth, especially that you're putting it under tension, trying to adapt into a certain experience of force or whatever you want to call it. So these stuff will make you gain a lot of muscle, and then slowly when you progress and get enjoyment from bodybuilding or lifting, then you start slowly adding isolation just to enhance your compound movement. So let's say some guys do pull-ups. I would also consider chin-ups are one of the good compound movements to do. Some people are good in a certain position of the chin-ups and then they get weak, let's say by the end range of the chin-up. Then that means probably his arms are weak. Then he can start doing some isolation for arms. But for a start of good 6 to 8 to probably a year, keep doing compound and get good at it, because those will build the most muscles that you have.
So thank you, brother. This was very insightful. I think
Thank you,
the audience is going to love this episode. And for all those who want to follow Abdullah, I'm sure most of the guys already follow Abdullah, and he has an amazing profile, and I've been following him for years. So of course I'll be putting his account in the mentions. And we'll be happy to do another episode sometime
Definitely,
soon.
doctor,
And we should
definitely.
talk more about exercise physiology and biomechanics.
Definitely.
I did a recent course in biomechanics. I went to Coach Qasim, if you know Qasim.
Oh, really?
Hansen.
Yeah.
So I
Qasim
was
is a
in
good one.
Colorado for 3 months back.
MashaAllah. Okay.
I went there all the way just for the course.
Okay.
So I
You know RTS? It's this guy that taught Qasim and taught even Joe Bennett.
RTS.
They're doing it in the dungeon very soon. I have a meeting with them on Monday. That
interesting.
one you should also attend.
It's biomechanics.
It's
as well.
biomechanics.
I would love to.
It's something to.
So and for all the guys who are keenly interested into the science of bodybuilding, which I think everyone should, that should be basics if someone want to get into bodybuilding, because you don't want to just go in as a newbie and injure yourself and then have other problems. You should definitely be following Abdullah and Dungeon, because they post a lot of, you guys do a lot of scientific, workshops and everything, right?
Yeah, we do seminars, at the dungeon, and also we do post a lot in our social media platforms, YouTube and Instagram. And I think that was one of my. I do podcasts all the time, but this is one of my best talks. In English. English is my second language. I usually do it in Arabic, and it's a pleasure that Dr. Hardik chose me as a first guy to be a guest in this podcast. Inshallah, it's going to be more episodes, and maybe we get Dr. Hardik to my channel. Inshallah, I'm really thankful, brother. I'm grateful.
Thank you
so
so much.
much.